I've got a few videos I want to share with you guys tonight, and these are videos that I pulled from yesterday's Senate hearing, and over the next few days I'm sure I'll be releasing even more videos for you, but just to have some truth and know what's going on, because like I said, the Senate hearing took place yesterday. They're not announcing it. It goes by, and then, oh yeah, well, we already met about that. So let's see what's going on. Let's take a look at the first video, and we'll talk about it.
Our case rate per 100,000 population is at 696 over the last 14 days, almost 3 times as much as Los Angeles, a county with a population of 10 million. In just a couple of weeks, over 500 patients have been transferred out of Imperial County into other California hospitals. To be clear, stay-at-home and face covering orders have been and remain in place in Imperial County. At this time, dine-in restaurants, bars, personal care services, and all other higher-risk workplaces remain closed. Thus, the logical question is, what is causing the surge of cases and hospitalizations in our county? Without a doubt, Imperial County is a highly mobile population. Even with international crossing restrictions, over 20,000 people are still crossing the international border from Mexicali into Calexico on a daily basis for work, healthcare, and other business.
There you have it, right there. I mean, we got a couple more videos to go through, but let's just highlight a couple things. Number one, just in the last couple of weeks, 500 patients flown out of there into other places, namely Riverside County. So there's that. We take a look at the fact that they said that the citizens that are living in Imperial County, they have to wear the face masks. They have to be sheltered in place. Mm-hmm. They have to shut their businesses down. They have to, ruin their livelihood. And yet the border there is open. She says 20,000. We're going to hear somebody else in a moment that gives you the figure of 25,000. But this is 20 to 25,000 people per day coming in and out of our border. And this is them saying, this is why we're seeing the spike, because there's people down in Mexico that are coming in here, they're sick, and they're bringing it here, and we're seeing a huge spike. So we're shutting down American citizens' businesses and livelihoods, but we're just opening that up.
I've talked to a lot of people about this, and here's the humanitarian part of me, and of course we want to help as many people as we can, and I feel bad for folks that are living in Mexico where they don't have good health care, and to the extent that we can help them, I'm all open to that. But we need to tell the truth first. I'm going to be on Dennis Prager tomorrow morning at 9:30. Yeah. I'm super excited and really nervous. And Dennis always says, and maybe you've heard him, first tell the truth, then give your opinion. We're not telling the truth. I'm not opposed to helping people if we have capacity, but tell the truth about it first. And to the extent that we're bringing people into this country and it's harming us, let's tell the truth about that as well. We need to take care of our own citizens first. It's sort of like when you fly on an airplane and the flight attendant is teaching about the oxygen masks. You've heard this before. First, put your own oxygen mask on so you're in a position to help whoever you're flying with. Same thing. First, let's make America as strong and healthy as we can. We'll be in a better position to help the rest of the world, not the other way around. We're seeing that. I practice in South Orange County in Newport Beach. Hoag Hospital is our hospital. And the same thing is happening there. Because we've done such a great job and we have capacity at Hoag, we're seeing people brought in from outside of Orange County, and then they're counted as Orange County cases, and I don't think that's right. First, tell the truth.
Well, let's take a look at one more video. I just got a couple more, but let's take a look at the next one.
With cross-border crossings from Mexico, even though that they have limited to citizens and legal residents, this has impacted disease transmission and hospitalizations in both Imperial and San Diego counties. However, the limited resources that Jeanette just spoke about in Imperial County make that a bigger challenge for both the public health aspects of this as well as the health care delivery and infrastructure. I don't want to repeat what Jeanette has said, but with a population of 181,000 and a million people in Mexicali, We have about 25,000 traveling across the border every day. That has, really working in their essential workforce has put big strain on Imperial County. On the flip side, we have San Diego County with a population of 3.2 million, daily border crossings of 75 to 80,000. They have a robust EPI team monitoring data to produce weekly reports showing impact in the zip codes along the border, much higher per capita rates than any other part in what they call the South Bay. Consistently 60 to 70% of hospital admissions are those that traveled to Mexico or were connected to a family member who traveled to Mexico.
So you didn't hear that on the news at all, did you?
No, you don't hear that.
No.
But we're told going to restaurants, and I don't know any restaurant that I've been to where you're not socially distanced and they all require masks. We're told that's the problem, not that going to restaurants are the problem, but thousands of people rioting, that's not the reason why we're seeing COVID-19. We've entered crazy town, seriously.
Right. And here's the thing is, I'm looking at what's going on. We want to know the truth, and I think we're hearing the truth. I don't think that this is a lie. I think this is the true statistics that they're giving it, and and that way they can say, hey, we gave the true statistics, but nobody's going to report on it. 100,000 people per day crossing our border, and there's huge spikes down there. We know that in one day in Mexicali, one day had double the amount of COVID-related deaths in one day than the entire state of California.
Yeah.
So if it's that bad of a problem, and we have to shut down our businesses, we have to shut down our livelihood, we have to shut down our churches, we have to shut down our schools, we got to shut down everything here, then shut the border down. Like we were told it's shut down.